So today I want to start off the year talking about the most common type of cavity that people can get and how to prevent them. So the most common type are going to occur on the biting surface of the teeth. We as dentists classify cavities. We classify them in 6 different ways, but I'm only going to talk about one way. It's the most common and simple cavity that people get. So we get 3 sets of molars. We get a set when we're 6 years old. A lot of parents don't notice when they come in because when those come in, they actually do not knock out any baby teeth. They just sneak in behind. And then when we're 12, we get another set, meaning another 4 when we're 12. And then our 3rd set, those are wisdom teeth. So those are going to start coming in and or causing a problem when you're about 18 to 20. So when you're 6, come to see the dentist. We may talk about dental sealants, and that's what we're going to talk about, and that's, again, preventing this most common type of tooth decay. So let's take a look at these pictures here. So this is an example of a really healthy first molar right here. Down here, it's just this blue around it is something we've done at the dental office, but it's very healthy. There's no cavity there. So these grooves here, I'm going to use this for pointing, then I'll explain what it is. So these grooves right here dive down into the tooth kind of on a microscopic level, so no matter how you're brushing on top, you can't get down inside there and clean. So we'll place the sealant. Here's an example of the same tooth after it's had a sealant on. You can see how it just looks kind of smooth and shiny, and there's no bacteria getting down inside of those grooves. So a sealant is done by using this. This is a cleaning agent. It's not a needle. It scares kids sometimes. It doesn't poke you. Goes on, we rinse it off. A sealant material is placed on top. That's what you're seeing here. It comes in this little tube. Thank you, 3M. ClinPro sealant, we use that. We place it on top. When it comes out, actually, this particular brand is pink so that I can see where it goes on top of a white tooth. And then we'll use this curing light, really bright, to set that up. So now you can't even see it. It turned white. Sometimes for kids, I'll do these on my fingernails so they can see. That neat process of how that sets up. So that's designed to stay there and help to prevent the cavity by preventing bacteria from getting down inside those grooves. Sealants are a really great preventative tool. Again, though, only protecting against the one type of cavity, the most common type, on top of the tooth. You can still get cavities between your teeth if you're not brushing, flossing properly, also on the sides of them, things like that. That's for another day. Here's another picture of a tooth that it started to get a cavity inside. So these grooves are kind of opened up a bit. It's starting to look a little, just kind of achy, compared to that one. So in this case, we'll just use a tiny, tiny drill bit to open these up a little. Kids don't even need to be numb. They don't feel this. And then we can place the sealant. If you don't get this done, things progress. And that's why we have these pictures right here. So this picture is actually still a pretty mild cavity, but it is going to get into the tooth enough to where, your 6-year-old, I'm going to have to get them numb. And then it's a different kind of experience for them, which most kids do really great, but, it can be really scary. So this one has a little bit of sealant, some of which has chipped off. Sealants can chip off, and that's something that we will check for at your regular checkups. So it looks brown in there. Anybody can see that. Somebody's taken a drill to it and opened it up a little bit. It still looks pretty brown. By the time we get the whole cavity out, it's down into the next layer of the tooth there, which has feeling, which is why we need to numb when we do these types of fillings. So we're going to fill that in. This doesn't have a final picture, but when it gets filled in, it's going to look smooth and white like a composite filling. So that's just something really common that people hear when you bring in your 6-year-old, 12-year-old, whatever, when those new teeth come in, you want to get those sealants on before you get tooth decay. It's really important to do. Oftentimes, when I see this decay on the top of the tooth, it doesn't look that bad. And when I take the drill and open it up, sometimes it just dives in there. People even need root canals if it goes too far. So prevention is key. So make sure that you come in and see us for regular checkups so that we can treat your cavities, but preferably prevent them. Thanks for tuning in. Have a good week.